Happy International Women's Day, everyone. It's another day and we're celebrating the social, economic, cultural, and political achievements of women across the world. The theme of this year is Digital. That's innovation and technology for gender equality. It's Wendy on the View. Welcome to the show. I am Murayo Afolabi Brand. As always, I have the ladies with me. Hello, Biajilu. Happy International Women's Day.
Happy International Women's Day. I'm excited about today, maybe because of women. The fact that we're celebrating our International Day. And I just want every woman to know that they are worthy. Every woman should know that they are strong, that they have powers within them. They have the capacity to be, to do whatever it is that they want to do. And they should stop limiting themselves. You know, we keep talking. The last event I had to speak to some secondary school girls. And I remember one of the things I told them was that they should make themselves proud in every situation. They should put their hands on their chest and say, I'm doing this to make myself proud. So it's okay to make your parents proud. It's okay to make your family members proud, but you are still the most important person. And anything that you're doing that will bring that down, you should desist from it. And so I'm telling every woman out there today that you are amazing and it's okay to want anything that you want. Your wants, your desires are valid, and make yourself proud.
Okay, hello Nima, how you doing?
Fine. Thank you, BC, for the International Women's Day, because that says it all.
Right.
Anything else? Yeah, okay. Since we have talked International Women's Day, let me see. In what way have I been an example, I guess, as a woman? So this year, when we started this year, I really wanted to work and build the relationships that I have, like, you know. So I registered my siblings and I for a 1-month gym membership. And it was not about going to the gym to lose weight or anything, but it was a form of bonding for us. And we have learned so much. We've even become closer because we now have time that... So first of all, at setup, we have meetings. That was late last year. We have meetings. We've now gone on to, you know, working out together. And I'm realizing, and it's important because I'm realizing that you have to work on relationships. And I feel that women are always the ones that think about these things. And so as a woman, I've put that into consideration, and I'm bonding my family better. I'm making us much more, you know, closer. And because of that, we're even having ideas that can empower us in so many other ways. So yes, happy International Women's Day to everyone.
So I'm pretty excited also about International Women's Day. The theme this year is Digital, which is innovation and technology for women. I think it's important for women to become active agents in STEM. You know, in science, technology, engineering, and mathematics, and it's important that women are also given opportunities in this sector, especially. So I'm happy today. I'm going to be speaking at UNICAF about educating women. I'm also going to be attending Wema Bank. So I'm pretty excited about today. We must celebrate women today. It's one of those days to remind ourselves as we are getting educated. Let's also educate the boy child, because they are the men that are going to be partners to these women in future, and they must be real partners. And equality must become the future notion of women, of development. We must be equal in gender, family, businesses, in the corporate world, in every areas of life. There should be gender equality so that women have the full capacity to achieve that which they've been created to do.
Digital.
Let's go, on a quick break. When we come back, we'll look at the front pages of the papers. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.
Okay, we're going to start with the nation. INEC, reset of BVAS, a must for governorship poll. Excuse me. Daniel Jim Obamidele, 98 senators-elect, get their COR, that's certificate of return. Banks pay old Naira notes to customers. APC supporters march for democracy. Transform Nigeria, NSCIA tells Tinubu. Sanwo-Olu takes campaign to markets. Okay, which story are we starting with?
Should we start with major headline? Okay, so applications already are before the presidential tribunal, election tribunal for, you know, BVAS resets. So the Labour Party and the PDP are saying that, you know, they should reserve the status of the BVAS as it is until the entire petition is seen to. But the INEC is saying we need this same BVAS to conduct the next poll this weekend. And so we need to reset it already. Also, the APC have applied to the petition, the election petition, to inspect election material used and get copies of it before time. So I think the APC is in the right order, not because of any sentiment now. You can inspect and take copies that you need for your petition, while the BVAS is used for the polls. But the other parties are saying retain it as it is without. And INEC, at this point, hands are tied. People are now suggesting that the elections for this weekend will be postponed because of this situation that we have on ground. But, some parties know the right thing to do. They are also citing what happened in Osun State. And I'm saying Osun did not have an immediate election after the governorship election, so they could reserve things as they were. But as it is now, we have another election ahead, and things could be done differently. Also, INEC has sacked the INEC rec for Sokoto State, and the reasons are not given in the report. But the INEC has asked that the rec in Sokoto State, Dr. Noura Ali, be excused immediately, and it was signed by the INEC secretary in the state. They've also asked that the administrative secretary in Sokoto State immediately takes over and act and take liaise with the supervisory national commissioner for any clarification for that going forward. But the reason for that removal of the rec is not given.
Yes.
Okay, I have.
Muhammadu Buhari give a women's message for International Women's Day. He lauded the achievement of Nigerian women in all facets of life. And he said that the only thing now is that the women were underrepresented in the political space, and something has to be done about that. So that message, he says that he's saluting the hard work and dedication of Nigerian women, working tirelessly and achieving results in different fields of endeavor, from their sacrificing daily in the markets, to the farms, to the train, the next generation of leaders, to those breaking limits in education, sports, medical field, arts, entertainment, and even politics. They are still largely underrepresented, and we have to do something about it. He said also that he's very proud to have worked and associated with some of Nigeria's brightest women in his cabinets, government, and in the international community. He's thanking the Amazons that have served meritoriously as partners in the progress witnessed in his political, economic, and social fronts. Also, different organizations had their own messages to women. And the bottom line is that we need to still keep the fight alive for gender equality.
Yes, I've got banks pay old Naira notes. So some banks have continued to the payments of old Naira notes to their customers yesterday. But this is in spite of the failure of CBN to issue a formal directive to that effect. Nation says that they have been trying to make efforts. They've made efforts for to get clarification from CBN on, what the way forward is. They said they finally got a source who volunteered information on the matter and said that there's no information to add or to refute on the current scarcity of Naira at the banks, and asked that the nation goes to the different banks and, update themselves. So if we look at the different states, we have some bank branches that paid old Naira notes in Oyo, Edo, Rivers, Abia, Kwara, Imo, Anambra, Plateau, Jigawa, Akwa Ibom, and Yobe. There are some other states. So in Lagos, they mentioned that some bank branches paid and people received, but some banks refused to collect some people, when they go to the bank, refuse to collect the Naira notes because for them, they say that the traders, fuel stations,
not taking it.
Many other people are not accepting it. Even in Plateau State, they're saying many of the traders do not recognize the old notes as legal tender. So now, what do we have? We have a confusing situation.
Yeah.
We have Supreme Court that says go ahead. We have a CBM that is bomb. We have Nigerians that don't know whether we are using the old or the new. We're just scattered.
Yeah, so they're still expecting the CBN to say something about the 500 Naira and 1,000.
Yeah.
All right, so the Deputy Secretary General, Professor Salisu Shehu of the Nigerian Supreme Council for Islamic Affairs, yesterday lauded the victory of the President-elect Bola Ahmed Tinubu, who was saying specifically that the council is confident that he will bring to bear the wealth of experience in assembling an all-inclusive team of experts in the administration of our country in a way that would foster unity and peace, as well as engender sustainable development that we all crave, which was an important message at this time. Moving on quickly now to the Punch. Fuel stations, others reject old Naira. Bank ration cash, as we said earlier. Lagos cannot get lion's share as local governments share 2 trillion Naira. Fuel scarcity to linger till after election, says marketers. LP and NPP kick as police bar dogs from polling booths. Aviation fuel hits 850 Naira, 840 Naira. Airlines predict flight delays. Over 200 cyber attacks blocked during presidential poll. Beaver's data intact. INEC tells court and parties. Okay.
Yeah, I have local airlines on the airline operators of Nigeria have disclosed that aviation fuel, that the Jet A1, has become scarce, and the situation, according to them, may lead to flight delays. The Assistant Secretary of the Airline Operators of Nigeria says that the aviation fuel is not available. There's still scarcity, and yes. And then they talked about the prices. They said that sometimes that one thing with the aviation fuel is that it's the price is a deregulated market. So it's however the prices go and how much quantity you even buy. It says, but the prices usually range from 700 to 900. And it also shows that Nigerian aviation sector spent 192 billion in 2022 on aviation fuel. But they're also trying to explain that the steep in prices has a lot to do with the war that's going on in Ukraine and the increase in crude oil prices.
Yeah, that's very in Punch.
Yes. So there's scarcity of premium motor spirit. That's the fuel in Abuja and some other northern states. They mentioned Nasarawa, Niger, and more states up north. And they said the cost of petrol has risen to as high as 400 Naira per litre. The black market people are selling 450 to 500 Naira per litre. And they said one of the issues they're having is the fact that they are not sure of how the elections would hold. And so people are not moving their trucks to go pick up the fuel and supply. And that's what is. Then secondly, the fact that there's this cash crunch, the fuel stations are not collecting cash as well. And so people are not able to do their businesses. And so it's going to likely linger, especially in the north, till after the elections. Maybe then the queues will ease up.
Okay.
Any other stories in Punch? Let's take final story.
Labour Party NNPP kicks as police won. So the police PRO for Olumuyiwa Adejobi has read out section 126 of the Electoral Act that bans dogs and classifies dogs as offensive weapons, as some of their owners and handlers are saying that they would go to the polls with them this weekend as protection against dogs. But they also classify them generally, warning people not to do this, to bring their dogs to the polling units.
So don't bring your
protect themselves then?
Protect yourself.
How?
They'll come with dogs?
Whatever you consider.
What if you endanger someone?
No. The Electoral Act bans it.
I know, but they say that the rationale behind it is the fact that thugs will come in and attack. And thugs are more afraid of dogs than...
They are preemptive.
But do we obey the law or disobey the law because
no, of
someone is
course not. I'm just asking. There's a rationale behind why people are saying they are going to come out.
Well, are we saying that thugs cannot come out with dogs too? So should there be a dog?
Those dogs don't have dogs.
Yeah, what if they have dogs?
What if they now have dogs? It's okay, now we can bring out dogs. Let's bring out dogs.
You cannot be a dog.
Let's bring out Alsatians or all those bulldogs and
scare. Not let dog bite.
But that's not the point. The point is people are trying to protect themselves, so they should have looked at the reasons why this is happening.
They've looked at it. They provided security.
Which security?
Polling units are supposed to be safe places.
Yeah. Was
you
it
can
safe?
Call for backup. The soldiers were there at the last elections. But don't bring your dog. I have a trauma from dog bites. I cannot. Yeah. Don't bring your dog to a polling unit. I would not be able to vote. I won't even come close. So.
Right. Okay, because people can read it as a way to scare people.
Polling units.
Yeah,
exactly.
That's the.
But did they listen before? They were dog talks before.
Yeah, so it's across the country. Thugs were in every part of the country.
Are we saying that there was no security at all in other places? We know that something happened. We know that some places that there was. But we also know that security was provided.
Yes.
So to now say that people should bring dogs will make for a better, it doesn't. We're just making
it's like a self-help.
We're making it worse.
And self-help.
That's all we can take on Front Page Review. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.
Thanks for staying with us. Today we'll be taking a closer look at some of the successes of Governor Babajide Sanwo-Olu. Here with us now is the Honorable Commissioner for Health, Professor Akin Abayomi. Welcome to the show, sir.
Thank you. Good morning.
So we're looking at the review of the current governor of Lagos State, and we can't help but remember the work that was doing during COVID. And many have said that he was a successful leader that championed the fact that COVID did not overwhelm the nation as a whole. Could you give us some excerpts of what happened during that time, the challenges he had to face, and how he triumphed over COVID?
Yes, so, I mean, we all recognize that Lagos is one of those mega cities. It's a coastal city, it's low-lying, it's rapidly expanding. It has a very vibrant airport. It has multiple seaports, it has an international border, and it has connections to the rest of Nigeria. To feed 20 to 30 million Lagosians, you need to bring in a large volume of livestock. So when you put all that together, it's low-lying, heavily populated coastal megacity. It adds up in biosecurity parlance to high levels of vulnerability. So as you know, in government, you look at what's happened before, you look at what's happening around the world, and you look at what the projections are. And we've been experienced in the past with Ebola, with Lassa fever, with cholera, with flu. And we know how fast things can get out of hand. So in Lagos, we have this offensive approach to pandemic or biological shocks. We know our vulnerabilities, and we know that we need to intervene very quickly to make sure that whatever comes our way, we can get on top of it. So after Ebola, we were really very worried about what could have happened in Lagos. We were able to get on top of Ebola, but many of us traveled to Sierra Leone, Liberia, and Guinea, and saw what devastation Ebola rendered onto the economies. So we came back to Lagos, and with the then Commissioner for Health, Dr. Jide Idris, we were able to build on the past infrastructure to develop what's called the Lagos State Biosecurity Roadmap. WHO were telling the world that to expect a global pandemic within 5 years of that Ebola outbreak, which meant somewhere around 2019, 2020, we were to expect something big. And indeed, they were right. But we were listening to them, and we were preparing. Most people didn't know what we were doing. You know, why are you preparing for something so big? What's the deal? But luckily, we were able to be ready. And the day we heard about Wuhan, it was almost a couple of weeks after we commissioned our Lagos State biosecurity infrastructure. Oh. And so we just ramped things up, and you know, we in cabinet we identified that Lagos was at some point not going to be able to avoid COVID-19 because of our movement between Nigeria and China, right, movement between Nigeria and Europe. We started to see COVID spreading around the world, and it was just a matter of time. Right. You know, so when we got our index case, we were actually fairly well prepared. You know, we had the infrastructure, we had the human resources, we had the equipment. We learned a lot of lessons from Ebola, and so for us, it was time to be aggressive and offensive, you know, and make sure that we diminish the opportunity for the virus to get into the Lagos community. Right. And once it got into the Lagos community, we were able to put in place all our standard operating procedures to make sure that community transmission was minimized. Right. But as a government, you know, our main function is, and you know, when you heard that The Economist voted Lagos and Nigeria the 4th best COVID management environments, what they said was not how many people were saved or how many people didn't die. What they actually said was, these were the countries that were able to keep their economy open despite a pandemic. Right. You know, because we are really looking at human livelihood and security. At the end of the day, you can be too heavy-handed. We call it the tripod of biosecurity. You can be too heavy-handed with your public health response, and at the same time cause economic hardship, which leads to breakdown in law and order and loss of security. And then you lose more people from your economic hardship and your breakdown in law and order than you would lose from the pandemic itself. So government has to find that balance. And Mr. Governor really was fast to respond. He set up the incident command structure, which means that the management of COVID was elevated to the cabinet, the highest level of authority, which made it easy for us to make quick decisions and get on top of things.
Okay, so I know that when you compare Lagos to most of the states, it's nothing to compare, really. We have a lot of people coming into Lagos for medical care, what they can't access in their states. But let's talk about the primary healthcare centers. What was the situation that this current administration met, and how has it upgraded so far?
Okay, so we inherited quite a number of primary healthcare facilities. We have over 320. A lot of them were just repurposed buildings. So a local government chairman would identify an old office or a school and say, okay, we're going to convert this into a PHC. That's one. Very few of them were purpose-built. And many of them are very old, going back 20, 30 years. So many of them have some degree of wear and tear. The other thing is that according to the national rollout plan for PHCs, we're supposed to have at least one PHC per ward. Now, the way Lagos is designed, we find that sometimes we have 2 or 3 PHCs in a ward, and some wards don't have any. So we're looking now at 2 things. Mr. Governor has put in motion what we call the blueprint for medical transformation, which is looking at infrastructure and designing infrastructure fit for purpose at all 3 levels: primary, secondary, which are the general hospitals, and our specialist hospitals. So we got a group of international designers working with local designers who are experts in medical design, and we've developed what we call the blueprint for our transformation. And the first to roll off the blueprint was 3 prototypes of our PHCs. And these are beautifully designed, taking into consideration the movement of the sun, ventilation, the soil, the heat, infection prevention control, cultural practices. And we've come up with this beautiful design, and we're now beginning to roll them out in Lagos State, especially where we don't have a PHC in a ward. We've started to build.
How many has been built so far?
Well, we've just started the first 4. The blueprint came out 2 months ago. It took us about 2 or 3 years. Even during COVID, we were working on this blueprint. Right. So we've just got permission and approval to start. We're doing 4 this month. We're starting, and then another 10 throughout this year. Going back to the established PHCs, all those ones that we have identified that need refurbishment, we have approval to start working on those, which we've started. We've started going out to all the places where we've identified these PHCs. And the primary healthcare platform you see is the foundation of the PHC. And Governor Sanwo-Olu has said, look, we need to decongest the general hospitals and the specialist hospitals because we need to manage most of our patients at the PHC level.
Okay, I would like to also talk about, so infrastructure is there, but also we need to talk about affordability of healthcare. And I would like to know what this present administration and Governor Sanwo-Olu is doing with Lagos State Health Management Agency. That's the agency that's in charge of insurance for Lagos residents to get for health coverage.
So every state in Nigeria has what's called the social health insurance scheme. So for us in Lagos, it's called Ilera-Eco. Ilera-Eco is your health insurance, and up until late last year, insurance was more or less voluntary. Now, the new National Health Insurance Authority signed a new bill. Mr. President signed the NHIA bill, which had a major change in the law, which said that state health insurance is now mandatory, which means that if you're a Nigerian or if you're Lagosian and you're living in Lagos, you're doing business in Lagos, you're breathing Lagos air, just like if you are driving a car in Lagos, you must have insurance. You have insurance to drive a car, you must have insurance to live in Lagos. So every citizen needs to buy an insurance. We've done a lot of actuarial work on it. It's very modest. It's only 8,500 naira per person for an entire year. That insurance affords you access to a bouquet of services. Basic services like hypertension, diabetes, birth control, immunization, management of pregnancy, birth of a delivery of a child, cesarean sections, minor surgical procedures, the bread and butter of what all our citizens go to doctors for. 80% of patients, their conditions can be managed at a PHC, at the primary healthcare level. Complications, they get referred to the general hospitals. And if the general hospitals with all their specialists can't manage it, maybe it's a super complicated case, then that goes to LASUTH or to LUTH. Of course, we have private sector that are doing incredible work as well. So, we have this hierarchy of referral,
right,
but we want the bread and butter to remain at the primary health care. And the insurance that we're talking about, everybody with that insurance, you take your card, you go to your PHC or your private sector, wherever you're enrolled, and once you hand in your card, you don't get charged until you exceed the bouquet of services. Right. And then there's a fee for service after that.
Right. Let me go on a quick break. When we come back, we continue with our conversation with the Commissioner. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.
Thanks for staying with us. We still have the Commissioner for Health in Lagos State. Nima had a question before the break. Go ahead.
So COVID was a case in question that, really tested the how will I say, competence of this government. I wanted to, talk about, because I had COVID, I went to the center, I had to do a test, and I went back and forth. How did you get the doctors to stay? What exactly did they do, to get the doctors motivated enough to stay and fight with you guys?
So the COVID response, the medical personnel were divided into two. We have our biosecurity team who are centered around the infectious disease hospital. They're accustomed to dealing with very dangerous pathogens. So we've been training them for about 4 years before COVID. We had extensive training that if we knew that we needed other medical personnel, we had trained them just in case we needed to recruit them. But what we did during COVID was to separate COVID management from normal medical care. So we only managed COVID in about 3 or 4 of our hospitals and left the rest to deal with normal healthcare requirements and health-seeking behavior of our citizens. And that was a deliberate strategy on Mr. Governor's part because we didn't want collateral damage. So, if every hospital is designated a COVID hospital, then people will not go to the hospitals because they'll be scared to catch COVID, So people going for hypertension, diabetes, surgery, birth, and everything. In fact, we dropped the tariffs completely during that COVID period, and we saw an increased surge of people going to the rest of our hospitals for normal medical care, whilst we maintained COVID in designated centers.
Was that insurance package something to motivate those doctors to stay more? Because, yes, this is part of their duty. They had this call that they must, are there to, but was there a special package?
Yes, we had a hazard allowance, a special hazard allowance, and then lots of overtime because they were working 24/7. They couldn't even go home. We kept them in hotels because we were worried at the beginning that they would infect their families, So we put them up in hotels. We fed them, we gave them special hazard allowance. So they were, prepared for the outbreak.
Yes, I just wanted to when you talked about insurance, you talked about the 8,500 that Lagos resident has to pay. But is there anything that's been done by this administration for those who cannot afford to pay that amount?
Yeah, we have what's called the equity fund, where the government has a register of less privileged citizens who might even find 8,500 a bit too much to pay for the year of insurance. So through that equity fund and through a lot of donors, we are able to pay for citizens who feel that that fee or that tariff is too much for them, and so we pay for them, and so they can access the LERECO.
Let me come to the issue of research, because during COVID, one of the things we saw was the fact that many universities were actually seeing what they can do, how the vaccines that were provided was research based on university work. And we're really worried that in Nigeria, we didn't have any kind of proper research institute that was providing solutions. So I heard somewhere, I don't know if it's right or not, but Lagos State was also getting involved in research. Is that correct? Could you verify?
Absolutely. Yeah, from the word go, because, you know, you could have done a cut and paste. What are they doing in UK? What are they doing in Brazil? What are they doing in China? And just apply the same to Lagos. But from the very first index case, and then the subsequent cases, we already put together a very strong research team from University of Lagos and from Lagos State University Teaching Hospital. And there was a team of about 40 researchers that were looking at every case of COVID and observing the natural history of COVID in Lagos. And we found that there were significant differences between COVID here and COVID in different parts of the world. And indeed, other parts of the world found that COVID behaves differently in different ethnic groups. So we're able to adjust our response based on our indigenous understanding of what COVID does to our citizens. And that made a very large difference to how we're able to respond to the outbreak.
Okay, we know that we have a pandemic of brain drain across Nigeria, so to speak. And doctors just feel they are not getting enough commensurate to the work that they are putting in, and they opt for other countries. What has Lagos State, that's with this administration, done so far to keep their doctors here, and what's the plan going forward?
Okay, so we're looking at several things. First of all, if you talk about infrastructure, what is it that our medical personnel, you know, when we talk about medical brain drain, it cuts across all cadres, you know, doctors, nurses, allied medical professionals. So we're looking at the environment. So we're going through this blueprint I mentioned before, which is transforming the infrastructural landscape of Lagos State. Where you work, like I'm looking in this studio, and this is a nice studio. You want to come to work. So our infrastructure is very important for the mental welfare of our staff. So we're going through a massive transformation. We're building new hospitals, the Massey Street or George General, the psychiatric unit, infectious disease research center. These are all beautifully designed hospitals that take into consideration the welfare of our staff and our patients, and look at climatic factors as well. We're looking at their welfare packages. They have a lot of issues around their packages, which we've been addressing consistently and engaging with them. We're looking at medical tourism. So we want to make, in the Lagos State Development Plan for the next 30 years, Lagos needs to be the medical destination for medical tourism. For us to do that, we need to look at why our doctors are leaving Lagos and going to seek health in India, Dubai, South Africa. And we found that there are about 5 top reasons for that. So we're concentrating on that. One of them is cancer. The other one is heart and kidney and orthopedics. So we're developing these centers here. And what we're trying to do, people talk about JACPA. We're now talking about JACPADA. You know, so it's brain drain and brain gain. So our doctors from Nigeria in the diaspora, they want to come home. But what are they coming home to?
Okay.
So we need to now develop those specialist facilities for them. They've gone away and spent 10, 15, 20 years excelling in specialties, subspecialties of medicine. And then you ask them, come back home. Come back home to do what? You know, so a brain surgeon needs a place to come home and do brain surgery. A heart specialist needs a place to come back and do specialist heart investigations and procedures. A kidney specialist needs a place to come and do transplant. A cancer specialist needs a place where he can offer modern cancer therapy. So we are developing these facilities. So we're trying to reduce the push factor by improving the conditions of our doctors and medical personnel at home. And we're reversing it so that even if they do go, and there's nothing wrong with doctors going abroad. Doctors go abroad to develop themselves. They go abroad to get a broader experience of what's going on in the international environment. We want that. But what we do want is we want them to come back.
Attract them back. Yeah.
And that's the brain drain strategy that Lagos is using. And it has started working because our facilities are already attracting medical specialties from the diaspora. And, you know, these specialists that work in the diaspora, they're very mobile. You know, they can even carry out a consultation on Zoom.
Yeah.
They fly in, they do what they want to do, they fly out, they go to another part of the world. So the world is changing. Digital technology is changing the way we deliver healthcare. And I think we're taking advantage of that.
Let me let Nima throw in the last question.
I just wanted to know what packages you have for other members of, you know, the health team, the nurses, the lab scientists, all of the other people.
So we're working on every cadre of, you know, we're engaged with all of them. Is it the allowances, the salaries, the accommodation? We're looking at accommodation for medical personnel in all our hospitals now so that we can make life more comfortable for them. We're looking at hazard allowance. We're looking at better pay packages. We're looking at more comfortable working environment. We're looking at just elevating the respect, you know, and the whole atmosphere of the medical ecosystem.
All right, I think we can wrap up on that. Thank you so much for giving us an update
You're welcome.
on your administration, what you've done so far, and we wish you all the best.
And happy International Women's Day.
Thank you.
Thank you.
That's true. Any plans for women? Special plans for us?
Well, make sure you invite me, please.
Let's go on a break. When we come back, we'll bring in our next guest. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.
Thanks for staying with us. Joining us on the show now is the Managing Director, Chief Executive Officer of Lagos Bus Service Limited, Mr. Idowu Ogutono. Welcome to the show, sir. It's a pleasure having you.
Good morning.
Good morning. We wanted to start with transportation in Lagos because one of the things we have seen around is the buses. We see them parked in parking lot, not so much on the roads.
Right.
And we're thinking, when are these buses going to get on the road, and what exactly are the plans to decongest the bus stations, you know, in going forward for Lagos State government?
Right. So thank you very much. Maybe first of all, I'd like to wish you a happy International Women's Day.
Thank you.
And it's a privilege to be on your show. Right. So if you look at Lagos State is a mega city of about 23 million people. And that poses such a huge challenge in terms of how you organize the public transportation within the state. And so in trying to respond to that challenge, one of the things the government decided to do is a bus reform initiative. And that initiative essentially is meant to basically just reorganize the whole bus system within the state, from the infrastructure that supports the bus transportation and the buses itself, you know, and all of that. So currently, within the state, you have over 1,000 buses that are being operated by different operators. Now, Lagos State Bus Services Limited, which is the organization that I represent, is Lagos State government's direct intervention within that bus transportation space. And so as a company, the state has invested about 350 buses just within the span of about 2 years, right? And those buses on a daily basis provide mobility for over 70,000 Lagosians. And of course, there is a service plan in terms of how these buses are deployed. You know, it's very much unlike the informal operators where an operator can just have a bus and then pick up the bus in the morning and just decide on which routes they want to go on. But as a regulated bus service, right, that we actually have service plans, meaning that you have designated routes, you have the minimum number of buses that you need to put on those routes, you have timetable, you have schedules, and all of that. So what you find is that at designated times, right, we deploy our buses from our depots to stations, to terminals, to provide transportation from our commuters from point A to point B. And so today we currently are covering well over 30 bus routes, starting from 6 at the inception of this administration. And so you find that there's been such a quantum leap in terms of inclusion and coverage of this service from Festac all the way to Leventis, from Ajah all the way to Abule Egba, from Ikorodu all the way to TBS, across the whole city. So
let me sure I understand
yes.
what you said. So buses, we have about 1,000, right?
Yes.
You own, Lagos State government owns about 350 of that. Others are owned by private companies.
Operated by private companies, correct.
Just wanted to be sure I got clarity.
Yes, yes.
Go ahead,
yes.
Mary.
Yeah, so a lot of people, I mean, as we know, this is campaign season, and we've heard some of the conversations around that, especially about BRT lanes.
Correct.
And some people are saying that it would have been best to have other buses, mini buses, ply those BRT lanes. Why do we have it the way it is right now, where only BRT buses can go through those lanes and all the other mini buses go through the regular lanes?
All right. So the essence of having a BRT lane, which essentially is a dedicated bus corridor, that's the concept really. And what you want to do is you want to minimize travel time, right? And you must keep the road, those lanes, you must keep them as free as possible. You need to optimize it because it's got a limited capacity. Now, when you begin to now crowd those corridors with buses that are not under any regulation, there's no sense of, okay, what's the routes they're applying and all of that, it's just going to be completely chaotic, and that's what you have in other developed societies where you have bus lanes that are dedicated for mass transit utilization, right? So a mass transit bus, for instance, the buses that we operate, right, will carry 7 people per time, right, as against a car that will carry maybe about 4 people per time, So the effect of that is that with every bus you inject, you're taking off approximately 15 to 20 buses, right, off the road. And so you need to be able to optimize that corridor. And I think the conversation really should be about how we deepen the use of public transportation, right? So one of the mayors of Bogota in Colombia made a very profound statement, right? And said a developed country is not a country where the poor own cars, but where the rich use public transportation. And really that's where we should begin to drive, that's where we should begin to go to, where there is a deep culture of transportation, because the public transportation is reliable, it is efficient, it is comfortable, it is safe, and all of that. So the idea around opening up the corridor for other users is just going to defeat the whole idea, really, in my view.
Okay, so let's talk about affordability.
Correct.
Every Nigerian wants something cheaper.
Right.
We complain that our minimum wage is still very low, and so
absolutely,
you don't want to spend all of your salary in transportation. What is the plan for affordability for especially people who are using this transportation system to access their businesses and workplaces?
Thank you very much, and that's a very good question. So one of the mandates that we have as an organization is to provide affordable public transportation. And so if you look at public transportation, or the cost of transportation itself is quite high, right? And if you focus specifically over the last 1 month thereabout, there's been escalation in the price of, in the cost of petrol. There's been the cash crunch, and that has made the use of public transport, or transport generally, very expensive for people. But one of the things we've done really is to halve our existing fare, right? So we've taken off 50% from the cost of transportation. So relative to other modes of transportation, right, today, our service, right, under the leadership of course, of our governor, is 50% cheaper, right, than any other public transport that you will find. And that's essentially, one of the indices for measuring an efficient, public transportation system, by making it affordable. So regardless of your social or economic status, you are able to access this public transportation. And really that's what we're doing. So our public transportation at this point in time is extremely affordable.
Yeah. So let's talk about the routes that you go. Because you mentioned now you called Festac, and I'm thinking after Doba, is that how far your buses go? We in the interior, deeper into towards the Anoba Okoko, we're waiting to see when the BRT buses will come. Also, they have a strategic designated lane for the BRT buses.
Yes.
How do you then, expand into the interiors, the other areas that are not on the major roads?
On major roads. Okay, so good. So one of the things that has happened within the whole bus transport space is that you have different modes, right? So You have the high-capacity buses, which we operate. You have the first and last mile that seats about 6 to 8 people, right? So the idea is that the inner roads can only be covered by the first and last mile. So they help to provide that connectivity to the bigger buses on the major road.
I don't see those on the bus, on the road. Last miles. Do I see them?
I see them.
Oh,
I see them in the main.
White and blue?
In town.
The small ones.
The smaller minibuses.
Smaller one,
Intra.
but not enough in the area. I'm talking from the Badagry Expressway.
So my question is, sorry to cut you in.
Yeah.
But those small bus, the Kurukwe,
Well,
are they under your own
bigger than
your
no,
corporation?
they're actually bigger than Kurokwe. So they're under Lamata. Lamata is responsible for regulating the whole public transport system within the state. Lagos Bus Service Limited is the state's appointed bus operator. And basically we operate the high capacity buses. So you have other operators that do operate the smaller buses and that's responding to the last mile. So our bus takes you to a particular station and you probably still have about 3 kilometers to get to your final destination, all right? We can go within the inner roads. So the idea is to connect those smaller buses to our bus using the same payment platform, which is the Carry Card, and then providing comfort and accessibility for our commuters.
So I thought you also had those smaller last mile buses. I thought I've seen them parked in the parking spot. No, they're not yet out.
No, they're actually out, but they're not under our operations. So you have other operators, right? Because there's also the inclusion of private operators within the whole bus system in Lagos State.
So it's the BRT buses.
So we're speaking specifically to...
So how many do you have an idea of how many last mile, first mile buses
Yes.
are now out there? And what do you plan to do to build on the capacity of the buses?
Okay, all right. So there are currently 500 buses, first and last mile out there. And the idea is that, of course, government does not have the wallets to cut the check for all the buses. So the idea is that once you demonstrate the proof of concept with these initial 500 buses, then the private guys come in and they begin to fund and they do the operations themselves. So today, as of today, we have 500, first and last mile buses that are operating within the city.
How foolproof are your bus stations? Because when you get to a bus station, you
Yes.
should easily be able to identify, okay, this bus comes here, this time, I mean, how we see abroad, but you can actually predict, you can plan your trips based on that.
Absolutely.
So, but when you go to the bus, you're just asking people, madam, please, which bus is here? And how are you making your bus stations such that people can actually understand where the routes are?
Okay, so that's a good point you've touched on. Now, within the bus reform project, there is the ITS, which is Intelligent Transport System, right? And what that is basically made to do for you is to help for planning and scheduling. And part of the things that will do, which is currently being implemented by Lamata, is that at every bus station, you will have a passenger signage that speaks to the arrival time of the next bus, the waiting time and all of that. And all of that is integrated to a backroom, to a command and control center where those information, those data are being actually sent out to the commuter. So yes, we're not yet there, right? But that fits in perfectly into the bus reform initiative that the government is currently implementing.
Okay, we have to wrap up with it, but thank you. I mean, and just like the Mayor said, it's campaign season, so everybody's saying, what has this government done for transportation? Because many people are worried about the waiting time at the bus station. Sometimes, especially when there's fuel scarcity, you end up waiting so long. Do you have independent ways of fueling your buses such that it doesn't get affected by when we are having issues? You shouldn't be having issues. You have some kind of independent supply.
Absolutely. So, we speaking specifically to your fueling question. So we have a depot from where we stable our buses, we wash them, we maintain them, and we deploy them. And there we have a fuel dump. And we have a contract with a major oil supplier that provides us with diesel, and we ensure that we fuel our buses regularly. Now, speaking to what we've done, I think it's out there for us to see. So first off is providing the options for Lagosians. So if you want to go on a demand, you want to order for a cab, so you have the lag ride, right? That gives you option for you to call on the cab and then you can get on it. If you want to connect your first or last mile, you have the first and last mile buses. You want to get on the major road, all right? You have our own buses.
The lag ride is under you guys?
No, it's not under us, right? And then you also have, of course, we know the Blue Line. Everybody knows about the Blue Line. That's going to be providing mobility for over 500,000. We know about Lag Ferry and all the initiative going on within that space, right? All right. So idea is to connect all those buses so you have a multimodal integration such that seamlessly you can connect from one mode to the other. Now, part of the achievement that I've also said is about the affordability, right? At this point in time, 50% shave or haircut on your cost of transportation is massive, right? It's massive. And in terms of travel time, right? Today, if you get on the corridor, the BRT corridor, you save as much as 1 hour on your journey time. Right, so that is also a massive, right, massive achievement.
All right.
Yeah.
Thank you so much, Mr. Guntano, for joining us this morning. Appreciate it.
Thank you very much.
Thank you.
Let's go on a break. When we come back, bring on our next guest. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.
Thanks for staying with us. We have with us Dr. Adebola Odunsi. He is the Senior Technical Assistant to the government on LASEPA, and he'll be discussing various initiatives, one of which is the Eco Clean initiative that this administration started. Thank you very much for joining us on the show.
Thank you very much for having me.
We've been hearing about this Eco Clean Air initiative. I mean, we've heard about it from LASEPA. How is that going, and how far have you come?
It's foremost, it's fantastic to be here and to be able to talk about the environment, because it is one aspect of life that affects everyone. Nature versus nurture, they say. You can't have nurture without nature. You know, our environment determines so many things about how we turn out, right from our quality of life to our life expectancy. It ties into health. It ties into every facet of life, pretty much. So for us, ensuring that the environment is one of the most important things on the table is very critical to the government of the day. We have been charged, or we're charged as an agency, to look at how to bring to the average Lagosian the realities of the environment and what their duties to that and to the environment are. And this has birthed the initiative Eco for Clean Air, which is a mix of advocacy, of an advocacy strategy, built to bring policy education, policy awareness to the average Lagosian in terms that they can understand, and more importantly, to reskill and retool certain actors within the Lagos environment to enable them, you know, achieve the standard and statutes of Lagos State. You know, when we first came in, it was a little, the mode of enforcement was largely punitive, and we saw that this wasn't sustainable. You know, we can't use 300 officers to chase down 22 million residents. You know, so we had to look for a better model, you know, to apply a more sustainable model, which costs government less, costs the people less, of course, in terms of time, in terms of government spend, in terms of also deliverables. And we have seen massive success with Eco for Clean Air, which has dovetailed into several smaller programs such as Sanwo-Olu Switch to Gas as well, in which case we are changing the cooking fuel of choice in Lagos from solid fuels, what we call, you know, you find people using plastics, you know, to cook, which has huge health, deleterious health effects, you know, and that then blows back on the government spend on health. You know, we had the commissioner on here earlier, you know, speaking about affordability of healthcare and accessibility of healthcare. We as an environmental institution want to start from the beginning point where we can keep people healthy and prevent people from actually causing issues in the environment, which can then impact their health, impact education, and impact so many other facets of life.
On this show, we like to bring things down to the conversation where people can understand. Let me
but you mentioned something. Please, you said something switch. Could you?
Okay, Sanwo Switch to gas.
Sanwo Switch to gas. So if you don't use those unhealthy fuels, what fuels do we have available to use? And
fantastic. Nigeria has recently been or Nigeria is one of the largest gas producers globally, or has the potential to be one of the largest natural gas producers, you know, and from a federal level, a lot of action and a lot of initiative and a lot of policy is being driven towards switching people to cooking gas as a safe and easy to use and also affordable source of cooking. You know, a lot of people think firewood is cheaper than gas, but I'll be very, very pleased to let people know that gas is about 3 times cheaper than firewood. The issues surrounding safety are where the government is really focusing on, to make sure that people know the right attitudes and the right attitudes to adopt, you know, along the practices of gas safety, safe use of gas. But I mean, like I said, it's a very broad. It's a very broad project, being that the environment touches everyone. We are working harmoniously with several ministries, departments, agencies in the state to make sure that not only is this education going out, but we have the relevant agencies coming in to do their own part. So, for instance, the Lagos State Safety Commission is largely on board to help with training these street cooks and bukaterias and the like on how to safely use gas.
Right.
And we as an agency then come in and ensure that the environmental regulations are in place.
Okay, let me get a
for
few
that
questions
to
for
be
you.
possible.
Availability of gas as compared to firewood, since you made the comparison, but let's talk about you know, your offices, ASEPA offices across the state. How far-reaching are they, and you know?
Okay, fantastic. As I said, we have a mandate from Mr. Governor to bring the statutes and policies of environmental sustainability to the people. And the only way that can be done is through a massive advocacy drive. And that starts by being reachable in the first instance. So when the administration took office, we had about 8 zonal offices. And now that's been expanded to 20. Now, let me explain what a zonal office is. So, what a zonal office is. A zonal office is just a smaller version of our headquarters agency, where you can go in, lay complaints, pay bills, engage the agency as a partner. For instance, we do invite a lot of public sector and community level inclusive projects, in which case we adopt what is working in the communities and try to put government backing and policy to support it as well. So in terms of being able to reach the government, I don't think it's been easier. It's ever been easier than it is now.
Okay, let's talk about the first government-owned environmental laboratory. What's it about, and what have you achieved with it so far?
Thank you. So it is the first government-owned ISO-certified laboratory. Now, that simply means that we are operating a laboratory that the results are acceptable and verifiable globally. You know, we maintain the highest level of standards, and this was driven largely in part by the need to monitor what all these initiatives are truly doing. The agency currently deploys about 1,000 plus private consultants to industry, to private sector, to help guide on the regulatory requirements of the state. You know, there are certain environmental reports that are mandatory, that need to be submitted to ensure the fair and sustainable use of the environment.
Okay, so when you hear environmental laboratory, I was already thinking there's some chemicals people are mixing and forming. So is it really about advocacy, about training, about giving, also just having people spread the gospel of better environmental behaviors? Or is there some laboratory thing happening in this
so
place?
it's a mix of everything.
Okay.
It starts with advocacy, because if you do not know your duties to the environment, it becomes difficult to then enforce.
I wanted to pause you because I always try for this show not to speak over people's heads. You know, I like us to really get down to your daily, how your agency affects our daily activities. So, for example, I want my viewer to understand right now what you're saying as regards what is clean air. When I wake up in the morning, am I saying that nobody should be burning, and if I hear somebody burning or see somebody burning some kind of material or whatever, my plastic, should I come to you? Number one. Number two, are you there to help stopping the clogged gutters? Are you removing all the clogged gutters? The bottles we see I see some orange things around town, some orange big baskets around. People are putting recycled bottles in there. Is that from you? Is that part of your initiative? I just want to know how exactly is LASEPA affecting me, and how do I know the work they're doing?
So think about everything that you have spoken of.
Yeah.
Open burning, smoking vehicles on the
Right.
road, use of solid fuels to
Right.
cook. Now, there are individual agencies that are actually in charge of this, but in terms of a regulatory oversight,
Yeah.
So that's
that
what
is the
LASEPA
job of the agency.
Yeah.
Okay.
So it is our job primarily to let Lagosians know this is the standard of the environment that we expect
Yeah.
from everyone, so that my own actions
If I
do not
see that, I should
negatively
report to
affect
you.
you. Oh yes, by all means.
And then what do you do? Do you punish? Do you just educate? Do you
Fine
punish?
them.
Or do you compensate for something?
Okay, so if we went out and punished every offender, we'll have a long line of people complaining.
Right.
Yes.
Okay, so the whole attitude of the agency had to switch
Right.
from punitive enforcement, where we are chasing people down, locking shops and doing things like that, to a more sustainable method where people are the ones self-regulating. So that is why we leaned a lot on advocacy to make sure that there are ways. The main crux is to let people know it is doable. You can live in tandem with the environment. You can live. You can impact your environment in the right way if you have the right tools. So what we have done is we have gone into communities, for instance, to do pre-assessments to say, okay, what exactly is the reality in this community? What are the environmental challenges? What are the interplays that most people would not even know? For instance, you have an akara seller, who is operating beside someone decanting gas.
Yeah.
What are the realities of that for the environment? We saw a lot of issues of maybe explosions and the like. These are the things that we want to understand. What are the intricacies
Last
at
time,
community level?
Dr. Dolako Pashaya was here, saying she was talking about the fact that there was some kind of machine that was able to determine the level of pollution
Yes.
in certain areas, and they have some alarming figures across the state. What have you done? I mean, has the figures come down, or we're still dealing with this in these areas?
So the reality of events such as that is what has bred these initiatives, like the Eco for Cleaner initiative, where the government knows we need independent monitoring. And that is also what has guided the opening of this laboratory, in which case samples can be independently collected. Consultants can bring samples to the lab and know that at least at a very affordable rate, we can tell the reality of what is happening in the environment. And based on that, based on that strong
information.
data set, we can then take low-level solutions, using community solutions. We have a lot of, if you go into Lagos State communities, there are a lot of people, right from your mama that is picking bottles out of the trash, to people selling waste engine oil and the like. The government is now interested in regulating those spaces to make sure that it is being done right. And also the people that are engaging are getting the maximum economic benefit from it as well.
So, if I get you correctly, if I take a sample as an independent Lagos resident now, I take a sample because there's something I suspect to be unhealthy, in a gas or a smell I suspect to be unhealthy in my estate, and I bring it to the lab, I can independently have it.
I mean, I'm sure that I will take it that those samples have, of course, been collected in the right way. There are standards to collecting the samples that we bring in.
Okay, so let's get it right. If I can't meet the standard because I'm layman, I don't know. I just know that this thing is offensive to my smell.
Please just
whatever business they're doing, and I call the agency to come and get a sample. I can follow through and see an agent from your agency come and pick the samples and do something.
So there's another thing. Last time when when I hear that name, the next thing I think of is noise pollution.
Yeah.
Please, can you tell us about the noise pollution?
We discussed that too the last time. Now, some areas these people have not been arrested. Still shouting.
I mean, it's we need to police one another at the end of the day. The agency has continued to work hard, but we need the support of the people as well. It's not a one-man show. And that is why I push again that advocacy has been a huge part of what we've tried to do. If I tell you what is wrong, we believe in the power of self-regulation. We believe that Lagosians are law-abiding, well-meaning citizens, and we expect we definitely believe that. And we are, for instance, we've achieved a lot in terms of road transport workers. If you notice, nobody uses loudspeakers or megaphones to call passengers anymore. And that was as a result of a pact between the agency and the Ministry of Transport, you know, to ensure that we are limiting noise pollution from government sources.
How about churches?
Churches, churches, we are hoping to bring more to the table.
Okay. You have to pray about it.
Yeah, we are hoping to bring more. We're hoping to bring more of their representatives to the table. But of course, we've gotten very, very good positive signs from them that you know, denominations vary, and of course the leadership varies as well. So we don't take a one-size-fits-all approach. We believe in a bespoke solution. And it's a work in progress, but we are definitely making huge strides in it.
Okay, I think we should do more when it comes to that.
Let's go on a quick break. When we come back, we continue with our conversation. Stay with us. We'll be right back.
Stay tuned. Your View will be right back.
Thanks for staying with us. We still have our guest with us, Dr.
So let me just move on to the next question. I wanted to make a comment, but we've done that during the break. So what's happening with the school advocacy? How are you still reaching out to students? They say we need to catch them young. Yeah.
Yes. So we have adopted a strategy, in which case we have nominated our students as environmental champions, you know, to take this knowledge, you know, to take this new drive of the government to their very homes. We salute the adaptability of Nigerians and Lagosians especially. If you feed them with the right information, they tend to amend their ways. And like I said, as an agency of maybe 300 plus staff, we can't go to every house and knock down every door. But we believe that if we empower our children with information, with actionable policy, help them understand what a clean environment truly feels like, the benefits of a clean environment, even to themselves, you know, they are the people who are handing this over to at the end of the day. So it's a strong leg for the state, especially in public schools. We have through the Ministry of Environment and Water Resources, we have something called the Environmental Bees Club, which is a sort of extracurricular scheme, kind of like your Jets Club and your Literature Club and things like that, where environmental enthusiasts, you know, can get live involvement, can get hands-on involvement with environmental solutions,
This
environmental
happens weekly in
education.
schools?
Yes, please, across public schools. And as a pilot scheme, we're also looking to push into the private schooling sector as well.
Let's talk trash for cash. So I was driving my kids on Friday from work. They came with me to work and they saw a point where my son was saying, "Mommy, my teacher said, but is it true they pay for collection of trash? Is it possible?" And I have not seen a case. So I said, "I've not seen what they say they pay." So what exactly is happening for trash for cash?
Okay, so I will try and limit it to plastics, for instance. So I will have us know that over 400 million naira moves daily informally in plastics. 400 million naira.
Really?
So the mamas that are picking those bottles that sometimes wait for you at a party,
They're onto
you know,
something.
they are onto something, you know. And we have noticed that with improved regulation, with better partnership, with a more inclusive system, this is something that can even serve as a social subsidy scheme. You know, we have a lot of, the world is going through a global recession. Everybody's looking for new revenue pathways, you know, without necessarily increasing tax. And that's one thing that I would salute the government of the day. A lot of the initiatives have been put through without increasing taxation on citizens, you know, and we are, as agencies, as ministries and departments, have been tasked to create revenue from within the state without necessarily increasing tax. And I mean, this is one of the legs that Trash for Cash initiative stands on. Literally, it is give me what you have considered waste, and I will make value out of it. So we have everything going on now from direct exchange for social value. We have things like trash for health insurance, for instance, which is also being in partnership with the Lagos State Health Management Agency, LASHMA. We have a partnership running with the Ministry of Transport through the Cowrie Cards scheme, where we can offer free public transportation for returning plastics. We are working closely with the Ministry of Education to try and roll out a trash for tuition scheme and the like. We are piloting this at a very rapid pace, and we are seeing the value right from private sector through to non-governmental organizations, through to civil service organizations, civil society organizations, all of whom have a huge part to play. Okay. You know, we are not reinventing the wheel. Yeah. This is something that people are already doing. We're just adding more structure to it.
So, like, what would you do?
You have to wrap up. Oh, we still run out of time, but thank you so much, sir. It was a pleasure having you.
Thank you very much for having me.
Information on all the work that's been done at StarTimes. That is all we can take on today's show. Hope we learned a few things as we have. Have a great day. We'll see you tomorrow. Cheers. Bye for now.